Welcome to today's presentation, Understanding Temperature Regulation and its Impact on Vital Signs. I'm Professor Capron. Let's get started. Let's look at our learning objectives for this presentation. By the end of this presentation, you will be able to understand the physiological mechanisms of temperature regulation, identify the organs and systems involved in temperature control, and recognize the impact of various factors that affect body temperature. Let's look at some vocabulary words that you need to know. Homeostasis. This is the body's way of keeping its internal environment stable, even when the outside environment changes. This helps keep body temperature, blood sugar, and other vital conditions within a safe range. Hypothalamus. A small area at the base of your brain that helps control things like hunger, thirst, sleep, and body temperature. It sends signals to the other parts of the body to help keep everything balanced. Thermoregulation. The method your body uses to keep its temperature steady, whether it's hot or cold outside. This includes sweating when it's hot to cool down or shivering when it's cold to warm up. Conduction. The way heat moves from your body directly into something colder when you touch it, like when you step into a cold shower. Convection. The way heat leaves your body when air moves around you. For example, you feel cooler when a fan blows air over you. Radiation. The release of heat from your body into the air around you without touching anything. This happens all the time, but is more noticeable when you're near something much colder, like a cold window. Evaporation. The way your body cools down through sweating. As sweat evaporates from your skin, it takes heat with it, lowering your body temperature. Diaphoresis. This is just a fancy word for sweating a lot, especially when you're hot, exercising, or feeling nervous. Fever. When your body temperature is higher than normal because you're fighting an infection, it's a sign that your immune system is working to get rid of germs. Hyperthermia. When your body gets too hot, usually from being in high temperatures for too long, like on a hot day or in a sauna. This can be dangerous if your body can't cool itself down quickly enough. Hypothermia. When your body temperature gets too low, often from being in cold weather without enough warm clothing. This can be very dangerous and needs to be treated quickly. Today, we're going to focus on body temperature, which is one of the essential vital signs that we monitor. Keeping track of temperature is crucial because it provides us with valuable insights into a person's metabolic and physiological health. Understanding how to measure and interpret temperature can help us detect potential health issues early on and manage ongoing health conditions more effectively. As future nurses, you'll find that this knowledge plays a critical role in assessing patient wellness and implementing appropriate care strategies. Body temperature reflects the balance between the heat our bodies generate and the heat they lose. It's a crucial indicator of a variety of health conditions. Typically, a normal body temperature suggests that the body's metabolic and physiological processes are functioning correctly. Any deviations from this norm, whether high or low, can be a signal that there's an underlying problem. As we look deeper into understanding these variations, we'll see how they guide us in diagnosing and managing health issues effectively. The body keeps its temperature steady through a process known as thermoregulation, which is controlled by the hypothalamus in the brain. Think of the hypothalamus as the body's thermostat. It retrieves information about the body's current temperature and makes adjustments to various bodily processes to maintain it within a normal range. Understanding how the hypothalamus functions to regulate our body temperature is crucial, especially when assessing how the body responds to infections, environmental changes, or other factors that can influence temperature. Heat in our bodies is primarily produced through muscle activity, which includes everyday actions like walking or digesting food, as well as through basal metabolic processes. These basal processes are the body's background operations that keep us alive and functioning, even when we're at rest. Additionally, hormones such as thyroxine and testosterone play a role in them by increasing the metabolic rate, which in turn raises body heat. It's fascinating to see how even the smallest hormonal changes can affect our body temperature and overall health. Heat leaves our body in various ways. We can lose heat through radiation. That's when heat radiates from the body into cooler surroundings, like when you feel your face cool down after going outside into the cold. Then we have conduction. That is the direct transfer of heat through touching something cooler, such as if you sit down on a cold bench. Convection is when heat is carried away by air or water molecules moving over the skin. Think of a fan blowing on a hot day, or wind chill making you shiver. And then evaporation is loss of heat through the evaporation of sweat. This is why we sweat more when it's hot. Sweating cools the body down as heat is used to turn sweat from liquid to vapor. Keeping our body temperature balanced is very important for staying healthy. If this balance can lead to problems. For example, if our body makes too much heat or doesn't cool down enough, we can end up with hyperthermia, which is basically overheating. This can happen if you have a fever or if it's really hot outside. On the flip side, if our body doesn't produce enough heat or loses too much of it, we, we can get hypothermia, where our body temperature drops really low. This is something that can happen in very cold weather. So understanding how our body manages its temperature helps us keep it in check and helps to prevent these extreme situations. In clinical settings, keeping an eye on body temperature is crucial because it helps us to catch any imbalances early on. This monitoring is key for diagnosing conditions, checking how well treatments are working, and giving immediate care when it's needed. For example, if someone's temperature is higher than normal, it could be a sign of an infection. That would prompt us to look closer and possibly start some treatment with antibiotics. It's all about being proactive and responsive to what the body is telling us through it. Let's take a closer look at how the body keeps its temperature just right. We're going to focus on the main contributors, the skin, the hypothalamus, and the muscles. Each one plays a unique part in maintaining the balance needed for our body temperature to stay stable. Understanding the roles of these key players helps us see the big picture of how our body manages heat, which is super important for keeping everything running smoothly. So let's look at the organs involved. First of all, the skin. The skin isn't just our body's largest organ, it's also a major player in how we react to the environment around us, especially when it comes to regulating our temperature. Here's how it works. When it gets hot, the blood vessels in the skin open up wider, a process called vasodilation. This allows more blood to flow close to the surface of the skin, letting more heat escape into the air. On the flip side, when it gets cold, these vessels tighten up and narrow, which we call vasoconstriction. This reduces the blood flow through the skin, helping to keep our body heat from slipping away. So the skin does a lot more than just hold everything together. It plays a crucial role in keeping our temperature balanced. The hypothalamus, tucked away in the brain, acts like the command center for controlling our body temperature. It gets the lowdown on what's happening, both inside and outside the body, thanks to signals from nerve cells in the skin, deeper within the body. Whenever the hypothalamus notices that our body's temperature isn't what it should be, it jumps into action to bring things back to normal. It sends out signals to the muscles, the heart, and other organs to adjust our temperature, either by warming us up or cooling us down. So it's pretty much the boss when it comes to keeping our internal climate under control. Muscles are super important, especially when it comes to heating us up. Here's how they jump into action. When the hypothalamus in our brain figures out we're too cold, it sends out signals. Muscles contract without us even trying to move them. This is what we call shivering. Though it might not feel great, shivering is actually a really effective way to generate heat and help bring our body temperatures back up. It's like having an internal heater that kicks on automatically whenever we start to get chilled. So now look at the interaction between the nervous system and these organs. Think of the temperature sensors in our skin and throughout our body as tiny reporters, constantly gathering and sending updates to the hypothalamus about our internal and external temperature conditions. This steady stream of information flows through our nervous system, allowing the hypothalamus to process it on the fly. Again, it's the control center, and it uses this data to tweak our internal settings, ensuring everything inside us stays balanced and runs smoothly. This mechanism is crucial for keeping our body's environment stable, no matter what changes occur outside. Our autonomic nervous system is pretty amazing. It works behind the scenes, mostly without us even realizing it. It's always making adjustments, like controlling our blood flow and managing how much we sweat, all without a single thought from us. And when it gets really cold, that's when it kicks into higher gear by triggering our muscles. The muscle contractions are its way of generating heat to warm us up quickly. It's like having a built-in thermostat and heater, and again, they automatically adjust to keep our temperature just right. This whole process is a sophisticated feedback mechanism where the nervous system plays a key role. When the body feels too cold, the hypothalamus gets the signal and jumps into action to crank up heat production and dial down heat loss. Again, if things are getting too hot, it does just the opposite. It cuts down on heat production and ramps up heat loss. These smart adjustments involve changing how much blood flows to our skin, how much we sweat, and even liver and muscles handle their metabolic duties. It's all about keeping our internal environment as stable as possible, no matter what's happening outside. Grasping how these mechanisms work is very important when we're taking care of patients. Take fever, for instance. Knowing that the hypothalamus will kick into gear helps us to decide the best treatment options. And it's not just about dealing with fevers. Think about situations where patients are in cooler settings, like in the operating room. If we know how the body naturally tries to compensate for the cold environment by releasing its heat out into it, we can be better prepared to keep our patients warm and comfortable. Warm blanket, maybe a bear hugger. This understanding lets us to anticipate needs and tailor care to ensure patients are as stable as possible under our watch. Now we're going to dive into the various internal and external factors that can affect body temperature. It's really important to understand these factors because they play a big role in how we monitor and manage our patients. By knowing what influences temperature changes, we can better assess how patients respond to different environments or conditions they're facing. This knowledge helps us tailor our care to each patient's specific needs, ensuring they get the best support possible as they respond to or recover from various health challenges. Let's talk about metabolic rate and how it affects body temperature. When you're active, like during exercise or even while digesting food, your metabolic rate goes up. This means your body is working harder and producing more heat, which can raise your body temperature. Hormonal changes, especially with thyroid hormones, can also crank up your metabolism and heat you up a bit. On the flip side, if your metabolic rate is lower, maybe due to conditions like hypothyroidism, or if you're fasting, your body cools down because it's not generating as much heat. Keeping an eye on these shifts is crucial for understanding and managing how your body reacts to different conditions. When it comes to infections, our body has a built-in defense mechanism that often involves cranking up the heat. Essentially, when you have an infection, your body may trigger a fever as part of the immune response. This increase in body temperature isn't just random. It's actually a strategic move by your immune system to create an environment that's less hospitable for the pathogens causing the infection. This is why monitoring for and understanding fevers is such a key part of assessing a patient's health status when they're fighting off an infection. Muscle activity plays a big role in regulating our body temperature. When you're active and your muscles are contracting, like during a workout or even just moving around, they generate heat. This naturally bumps up the temperature. It's like your muscles are not only keeping you moving, but also keeping you warm. On the other hand, when you're inactive, like during sleep, or if you're just sitting around for a long time, your muscles aren't producing as much heat. Consequently, your body temperature can drop a bit. This is why you might feel cooler when you first wake up or after sitting still for an extended period. Hormonal changes are another interesting piece of the body temperature puzzle. For instance, hormones like progesterone can actually raise your body temperature a bit. This typically happens during certain phases of the menstrual cycle or in pregnancy. It's like your body's way of adjusting to different hormonal levels. On the flip side, when there's a lack of such hormonal activity, maybe after the menstrual cycle or during menopause, you might notice a slight drop in your baseline body temperature. Unfortunately, along with menopause can come hot flashes, and they are quite a big jump in temperature. It's fascinating how these natural cycles influence our body's internal thermostat. Now let's look at the external factors. Let's not forget about the role of ambient temperature, basically, the temperature of our surroundings. When it's hot out, or if you're in a heated room, your body temperature can go up. It's responding directly to its environment. Conversely, in cold weather, your body temperature can drop. That's why you might start shivering when it's really chilly outside. Your body is trying to generate extra heat to keep up with the cold environment. Understanding how ambient temperature affects our body can help us stay comfortable and healthy, whether we're bundling up in the winter or finding shade in the summer. Clothing and covering are pretty straightforward, but very important when it comes to controlling our body temperature. If you're bundled up in heavy clothing or under a lot of blankets, especially in an already warm setting, you're going to trap heat close to your body, which can raise your temperature. It's like insulating your body, the same way you'd insulate a house to keep the warmth in. On the flip side, if you're wearing light or minimal clothing in a chilly environment, your body heat escapes faster. This drop in heat can make you feel colder quicker because you're not retaining as much warmth. It's crucial to dress appropriately for the weather to help regulate your body temperature effectively. Humidity plays a sneaky but significant role in how we experience temperature. When humidity levels are high, the air is so saturated with moisture that it can prevent your sweat from evaporating. Normally, this evaporation is a key way your body cools itself off. So when it can't happen effectively, you might feel warmer because your body temperature increases. On the other hand, when the humidity is low, sweat evaporates more quickly, which actually enhances your body's ability to cool down. So, understanding the impact of humidity can really help you figure out the best ways to stay comfortable and regulate your body temperature in different environments. Let's break these down into two simple categories to better manage and understand how they affect your body temperature. On one side, we have the factors that increase temperature. This is anything that has like an uptick in metabolic rate, like when you're sick or after a workout, or environmental influences such as hot weather or wearing too many clothes in a warm room. Even high humidity, which makes it tough for your body to cool itself. On the flip side, factors that decrease temperature could be things like a decreased metabolic rate when you're relaxed, not being active enough, chilly weather, or wearing light clothes that don't keep you warm, or even low humidity that helps sweat to evaporate faster and cool you down. Getting an accurate measurement of body temperature is crucial for assessing a patient's health status. Let's explore the most common ways that we measure temperature and discuss the right techniques to use at each site to ensure that we're getting the most reliable data. So what are some common sites? How about oral? Commonly used in older children and adults, we're going to place a thermometer under the tongue or in that little pocket next to the gum and instruct the patient to close their mouth, breathing through their nose, but don't bite down. Keep the thermometer in place for about 30 seconds or until the device signals that it's done. Rectal. This is considered the most accurate for measuring core body temperature, especially useful in infants and small children. We're going to apply a lubricant to the thermometer, then gently insert it about 1 to 1.5 inches into the rectum, depending on the size of the patient, while the patient is lying on their side. Hold it in place for about 30 seconds or until the reading is complete. Axillary. This is common and non-invasive, particularly suitable for newborns and sleeping children. We're going to place the thermometer in the center of the armpit, making sure it's touching skin and not clothing. Hold the patient's arm against their body to keep the thermometer securely in place until it's done. This one can take a bit of that 30 seconds, but most devices will beep when they're done. Tympanic or ear. This measures the temperature inside the ear canal and is known for being quick and pretty comfortable. So for most patients, you're going to pull the ear back and up to straighten the ear canal. But for our little ones, that'll be back and down. Insert the thermometer gently until it seals the ear canal. Press a button and wait for the beep to get the temperature. We also have what are called temporal artery or forehead scanners. These are non-invasive methods using infrared scanning to measure the temperature of the blood within the temporal artery. We're going to start with the sensor on the forehead, press a button, and slowly swipe it to the side of the head to the hairline before quickly lifting it off and placing it behind the ear. The reading is instant at that point. Choosing the right site depends on several factors, including the patient's age, the particular situation, and the need for accuracy. For instance, while rectal temperatures provide great accuracy for infants, oral tympanic measurements might be more suitable for older children and adults due to comfort and ease of use. We have some key considerations I want you to think about. Please ensure proper technique because it's essential for accuracy. Incorrect technique can lead to wrong readings that can mislead clinical decisions. Always check that the thermometer is properly calibrated and cleaned according to the manufacturer's instructions to avoid infections and maintain accuracy. Be mindful of factors that could influence readings, such as recent consumption of hot or cold beverages, heavy mouth breathing, smoking. All of these can affect an oral temperature. If the patient is sweating, you may not want to do a temporal artery. It can really throw that off. Mastering the art of measuring body temperature at these various sites will significantly boost your ability to assess and monitor patients accurately. Now let's look at the feedback mechanisms in our bodies, focusing specifically on how they maintain a stable internal temperature. Understanding these mechanisms is key because they play a crucial role in thermoregulation, ensuring that our bodies can adapt to changes inside us and respond appropriately to the external environment. Let's break down how these feedback loops work to keep everything in balance, often referred to as homeostasis. Here's what happens in a typical feedback loop for temperature regulation. Sensors are located in the skin and other parts of the body. They detect any changes in both the external and internal temperatures and send this information to the brain. The hypothalamus serves as the brain's thermostat. It receives data from the sensors and compares it to the body's set point, which is the ideal temperature your body strives to maintain. When the hypothalamus detects a deviation from the set point, it activates the effectors, like sweat glands, muscles for shivering, or blood vessels, to bring the temperature back to normal. Here's how it plays out. When body temperature rises, skin sensors pick up this increase and alert the hypothalamus, which in turn triggers mechanisms to cool the body down. This includes dilating blood vessels, vasodilation, to increase blood flow to the skin, and sweating, to cool the body through evaporation. When body temperature falls, internal sensors notice the drop, prompting the hypothalamus to kickstart warming mechanisms. Blood vessels constrict, that's vasoconstriction, to keep heat in, and shivering begins to generate more heat. Understanding these feedback loops isn't just academic. It has real-world applications, especially in clinical settings. Knowing that the body will try to generate heat when cold or cool down when too hot helps us to anticipate our patient's needs. If these natural mechanisms are overwhelmed, like during a fever or serious hypothermia, our timely medical intervention can be crucial in supporting the body's efforts to stabilize. For practical methods, this means actions such as ensuring a patient is hydrated enough to facilitate sweating, or providing additional warmth to those who are struggling to generate enough body heat. Recognizing the signs of these feedback mechanisms in action can guide our nursing care and help us to provide the most effective support for our patients' physiological needs under a variety of conditions. Temperature regulation varies significantly across different age groups, thanks to physiological and developmental differences. Understanding these variations is key to accurately assessing and providing the right care for each age group. Let's look at some normal temperature ranges and how age affects thermoregulation. So for newborns, their normal range is between 97.7 degrees Fahrenheit and 99.5 degrees Fahrenheit. They often will have higher body temperatures than adults, partly due to a larger surface area relative to their body mass. However, that also makes them at higher risk of losing their body temperature. Their thermoregulatory mechanisms aren't fully developed yet. They are prone to rapid temperature changes. By age 5, children should stabilize around the average temperature of 98.6 degrees Fahrenheit. Like infants, young children can also run warmer without any signs of illness, and their ability to regulate temperature improves as they grow. Adults generally maintain a temperature range from 96.8 degrees Fahrenheit to 100.4 degrees Fahrenheit, influenced by factors like activity levels, hormonal changes, and environmental conditions. Often, older adults have lower average body temperatures, usually between 95.9 degrees Fahrenheit and 99.5 degrees Fahrenheit. This drop is due to decreased thermoregulatory responses, less body fat, and slower metabolic processes. So again, young kids and infants lose heat quickly because of their larger surface area to volume ratio, and they also have less body fat to retain heat. Their systems for sweating and shivering are still developing, which makes their response to temperature changes less efficient than in adults. Adults have a robust ability to regulate their body temperature through sweating, dilation of blood vessels, and shivering. Still, factors like fitness level, body composition, and nutrition can impact how well they manage temperature changes. And as people age, their ability to regulate temperature decreases. Older adults may not sense temperature changes as acutely, and their slower metabolism may dull their body's natural thermoregulatory responses. Conditions common in older age and certain medications can also hinder their ability to maintain a stable body temperature. Now let's focus on what it means when body temperatures swing into the extremes, whether too high or too low, and how these conditions can point to underlying health issues that need urgent attention. We're going to look at fever, hyperthermia, and hypothermia and discuss essential nursing interventions to handle these effectively. So fever is more than just an increase in body temperature. It's the body's defense mechanism against infection. The body heats up to create a less favorable environment for pathogens. However, high fevers can be risky, leading to dehydration, metabolic disturbances, or even seizures. Understanding this helps us to balance the need to manage the fever while allowing the body to use its natural resources to help fight off the infection. Hyperthermia isn't about the body fighting an infection. It's when the body's temperature regulation is overwhelmed by external heat or excessive activity, and often it's a combination of the two. This can escalate to heat exhaustion or even heat stroke, which can seriously damage the brain and other organs. Early recognition of hyperthermia is crucial, especially for protecting those who are particularly vulnerable, like the elderly or those with chronic health conditions. Hypothermia occurs when the body is losing heat faster than it can produce it, often due to exposure to a cold environment. Severe hypothermia can severely affect the heart and nervous system and can be life-threatening if not addressed quickly. Immediate action is necessary to safely rewarm the patient, as prolonged exposure to cold can cause irreversible damage and potentially fatal arrhythmias. So, for our nursing interventions for fever, regularly monitoring the patient's temperature is key. Administer any prescribed antipyretics like acetaminophen or ibuprofen to reduce fever and discomfort. It's also crucial to ensure the patient stays hydrated, since fever can increase fluid loss. Educating patients on the importance of fluid intake and recognizing when they need more medical help are part of effective fever management. For hyperthermia, move the patient to a cooler environment promptly. Employ cooling measures such as applying cool cloths, using fans, or giving cool baths. If the patient is conscious and can drink, provide cool fluids. Notice I'm saying cool and not cold. Keep a close watch on vital signs and seek immediate medical help if there are signs of heat stroke like confusion, seizures, or the patient becoming unconscious. For hypothermia, warm the patient gradually using blankets, warm heating pads that are gently set, or warm air blankets if available. Avoid rapid rewarming to prevent complications. Close monitoring of vital signs and cardiac status is important because rewarming can trigger cardiac arrhythmias. Accurate temperature assessment is a fundamental nursing skill that goes beyond just knowing where and how to measure temperature. It also includes an awareness of potential errors and how to prevent them. So first, choose the appropriate method and site. The selection depends on the patient's age, condition, and level of consciousness. For example, oral temperatures are suitable for cooperative adult patients. Rectal temperatures may be suitable for some infants, maxillary for children, or tympanic if we just need a quick assessment. Make sure that the thermometer you're using is correctly calibrated and in good working condition. Use disposable covers if required, and clean the device thoroughly before each use, following the manufacturer's guidelines. Explain what you're going to do. This helps to minimize anxiety or discomfort, and this helps the patient to remain still, which ensures an accurate reading. Properly position the patient to access the measurement site effectively while keeping them comfortable. Position the thermometer correctly under the tongue or in that little pocket near the cheek for oral, gently inserted into the rectum for rectal, tucked in the center of the armpit for axillary, in the ear canal for tympanic, and across the forehead, and then touching behind the ear for temporal. Wait until the thermometer indicates the reading is complete. Immediately record the temperature and note the measurement method and any potential influencing factors like environmental temperature or recent physical activity. So our common errors and how to avoid them are improper site selection or preparation. Errors can occur if the chosen site is inappropriate for the patient or not well prepared. Taking an oral temperature right after drinking a hot beverage can lead to inaccuracies, for example. Evaluate the patient's recent activities and health before choosing a site. For oral measurements, ensure no recent eating, drinking, or smoking has occurred. For rectal measurements, clean the area and use lubricant for accurate and comfortable insertion. A thermometer that's not properly positioned can also give a false reading, like placing the oral thermometer just at the very tip of the front of the mouth instead of getting it well into the oral cavity. Follow guidelines for each type of thermometer to ensure it's well positioned to capture an accurate temperature. Room temperature or recent ingestion of hot or cold substances can skew results, so manage the environment. Eliminate drafts. Ask the patients to avoid any substances that significantly alter mouth temperature before doing an oral reading. Using a faulty thermometer or using the thermometer incorrectly can lead to incorrect temperatures. So regularly check your equipment's calibration and make sure you understand how to operate different types of thermometers. If you rush the measurement process, you're also going to get an inaccurate reading. So allow time for the thermometer to finalize the reading. This is usually indicated by a beep or a flash. And also, if you incorrectly record the temperature or fail to document necessary context, that can also mislead treatment plans. So always double check the reading. Note any relevant context that needs to be documented because it could affect the measurement, like environmental conditions or recent physical activity. Mastering accurate temperature assessment is crucial and requires meticulous attention to detail and a thorough understanding of each measurement method. Teaching patients how to monitor their own body temperature is an essential part of nursing that really empowers them to take an active role in managing their health. You will need to go over why monitoring temperature is crucial, how to do it accurately, and what signs to watch for. You need to explain to your patient that monitoring their temperature is a quick way to spot the early signs of an infection, inflammation, or other issues like thyroid problems. It's particularly crucial for those patients with chronic conditions, compromised immune systems, or patients recovering from surgery. Explaining to patients that their temperature is a vital sign that provides insights into their health can help them to understand its importance as a tool monitoring recovery and detecting potential issues early. Teach them how to choose the right thermometer. Remember, there are several types of thermometers. Each type has its pros and cons, and it's going to depend on factors like age, ease of use, and accuracy. Discuss the options thoroughly with your patients so they can make an informed choice about what works best for their specific needs. Make sure to show them how to use their chosen thermometer correctly. Make sure they know how to turn it on if needed, how to position it correctly, whether under the tongue, in the ear, or across the forehead. Explain how long it needs to stay in place to ensure an accurate reading, and teach them how to read and interpret the results correctly. Make sure to stress the importance of waiting a few minutes between checks if they need to take multiple readings. Guide your patients on how frequently to check their temperature because it can vary. For example, more frequent checks might be necessary during an active infection compared to routine health monitoring. Teach your patients to keep a temperature diary. Keeping a diary of temperature readings, noting the date and time of each, can be extremely helpful. It provides a clear record that can be valuable during medical appointments to evaluate the effectiveness of treatments or to monitor disease progression. Help patients to understand what normal temperature ranges are and what conditions might indicate. Make sure they know when they have to seek medical advice. Discuss how activities like exercise, bathing, or eating can skew temperature readings. Advise them to take their temperature when they are calm and rested. Recommend waiting at least 30 minutes after eating, drinking, or physical activity before taking a temperature to ensure accuracy. Teach them how to maintain their thermometer, including proper cleaning and storage methods to keep it accurate and hygienic. Make sure you finish your education session by ensuring that they understand everything that's been covered. Don't just ask if they have questions or need to see a demonstration again. Have them teach it back to you or provide a demonstration so that you know that they've understood the material thoroughly. So I know this was long, but thank you for your attention through the presentation. Let's take just a quick moment to recap the essential points we've covered. We've explored the intricate ways that the body maintains its internal temperature. This involves a dynamic interplay between the skin, the hypothalamus, the muscles, responding adaptively to both internal conditions and external environmental changes. We've looked at various methods for accurately measuring body temperature, including oral, rectal, axillary, tympanic, and temporal approaches. We've stressed the importance of selecting the appropriate method tailored to each patient's situation and condition, ensuring precision in our assessments. We looked at how abnormalities in body temperature, such as fever, hyperthermia, and and hypothermia can signify underlying health issues. These conditions require targeted nursing interventions for effective management. This emphasizes the critical role of accurate temperature assessment in the clinical setting. And we put some focus on the importance of teaching patients how to monitor their own temperature, including proper thermometer usage, understanding the frequency of temperature checks, and interpreting their results. By empowering patients with this knowledge, we support their active participation in managing their health. As nurses, we play a multifaceted role. This extends beyond providing care. We are also educators, health promoters, and early responders to health issues. Mastering the accurate assessment of body temperature is crucial. It helps us to detect potential health problems promptly, monitor the efficacy of medical interventions, and educate patients effectively on self-care.